Do you know how to take care of a pressure ulcer patient's back? Pressure ulcers, or bed sores, are a serious concern, especially for individuals who are bedridden or immobile. These painful sores can develop quickly and are often difficult to treat. One key factor in both the prevention and treatment of pressure ulcers is proper back care. The back, being a major pressure point, requires special attention to prevent these sores from developing. Understanding the correct process of back care can significantly improve a patient's quality of life. Before we delve into the process, it's essential to understand what a pressure ulcer is. Commonly referred to as bed sores, pressure ulcers are injuries that occur on the skin and underlying tissue. These painful sores are primarily caused by prolonged pressure on the skin, particularly in areas where the bone is close to the skin, such as the heels, hips, and tailbone. Apart from prolonged pressure, factors like friction and shear also contribute to their development. Pressure ulcers can range from mild redness to severe tissue damage that extends down to the muscle and bone. They can lead to serious infections if not treated promptly. This is why early detection and prevention are crucial. By regularly checking the skin for signs of pressure ulcers, we can initiate treatment early and prevent the condition from worsening. Now that we know what pressure ulcers are, we can move on to the steps of providing effective back care. The first step in caring for a pressure ulcer patient's back is regular positioning. You see, pressure ulcers, also known as bed sores, develop when there's too much pressure on certain areas of the body for extended periods. This is common in patients with limited mobility, where constant pressure can lead to reduced blood flow, causing tissue damage and eventually ulcers. Now, this is where regular positioning comes into play. By frequently changing the patient's position, we can redistribute the pressure on different body parts, preventing pressure buildup in any one area. Think of it like giving your body a break. Just as you would shift your weight around when standing for a long time, patients who can't move on their own need assistance to do the same. It's a simple step, but it has a significant impact on preventing ulcers. To be effective, repositioning should be done every 2 hours for bedridden patients and at least once an hour for those in a chair. But remember, it's not just about shifting the patient's position, it's about doing it safely and comfortably. That's where proper techniques and tools come in. Using pillows or foam wedges can help alleviate pressure and make the patient more comfortable. For instance, placing a pillow between the legs when lying on the side can prevent skin-on-skin rubbing, reducing the risk of ulcers. It's also crucial to take the patient's comfort and dignity into account. Always explain what you're about to do, and if possible, involve them in the process. It's about fostering a sense of control and respect, which can significantly improve their overall well-being. So, by now, you must have understood the critical role of regular positioning in preventing pressure ulcers. It's a proactive approach, a preventive measure that can save patients from a lot of pain and complications down the line. But let me leave you with this thought. Repositioning is a preventive measure, not a treatment for existing pressure ulcers. It's always better to prevent a problem than to deal with its consequences. So let's make regular positioning a standard part of care for patients at risk of pressure ulcers. Another crucial part of back care is maintaining proper skincare and hygiene. It's absolutely vital to keep the skin clean and dry, as this can significantly lower the risk of infection. When it comes to cleaning the skin, it's best to use a mild, fragrance-free soap and warm, not hot, water. Gently pat the area dry with a soft, clean towel to avoid causing any unnecessary friction or irritation. Now, while it's important to keep the skin moisturized, be mindful of the products you apply. Avoid those containing alcohol or other harsh ingredients, as these can dry out the skin and lead to damage. Instead, opt for a hypoallergenic, fragrance-free lotion or cream, which can help maintain the skin's natural moisture barrier without causing irritation. Regular inspection of the skin is also a key aspect of prevention and early detection of pressure ulcers. Look for changes in color or texture, areas of tenderness, or any signs of breakdown. These could be early indicators of a developing pressure ulcer. Don't hesitate to seek medical advice if you notice any of these signs. And remember, hygiene is not just about the skin. Keeping bedding and clothing clean and dry, as well as ensuring the overall cleanliness of the patient's environment, also plays a crucial role in preventing pressure ulcers. Proper skincare and hygiene are essential in both preventing and managing pressure ulcers. Finally, Let's not forget the role of nutrition and hydration in back care. A balanced diet and adequate hydration are crucial in maintaining skin health and accelerating wound healing. When we talk about a balanced diet, it's not just about eating a variety of foods. It's about ensuring that the body gets the right amount of necessary nutrients. For patients with pressure ulcers, a diet rich in protein, vitamins, and minerals is particularly important. Protein plays a vital role in the body's ability to repair and build tissues. Vitamins like A, C, and E, along with minerals like zinc and iron, are all key players in the wound healing process. Staying well hydrated is equally important. Dehydration can lead to dry skin, which is more susceptible to damage and slower to heal. Remember, good nutrition isn't just about eating well, it's about drinking enough too. Adequate nutrition and hydration can significantly contribute to the prevention and management of pressure ulcers. Let's quickly summarize the key points we've discussed today. We began by understanding what a pressure ulcer is: a localized injury to the skin and underlying tissue, often over a bony area, due to prolonged pressure or friction. This condition is particularly prevalent among patients who are bedridden or wheelchair-bound for extended periods. We then discussed the critical role of regular positioning in back care for pressure ulcer patients. By frequently changing the patient's position, we can reduce the constant pressure on certain skin areas, helping to prevent the development and progression of ulcers. We also highlighted the importance of maintaining good skin care and hygiene. Keeping the skin clean and dry can significantly minimize the risk of infection. Finally, we emphasized that proper nutrition and hydration are vital. A balanced diet rich in protein, vitamins, and minerals coupled with adequate fluid intake can promote skin health and accelerate wound healing. Remember, proper back care can make a significant difference in the lives of pressure ulcer patients. It's not just about treatment, but prevention as well.